Have you ever noticed unusual bumps or warts on your skin or private areas and wondered what they are? Or maybe you've heard friends talk about HPV and felt confused. Here's the thing: human papillomavirus, or HPV, is actually the most common sexually transmitted infection in the world. Think of it like a harmless cold virus, but for your skin. It can spread through skin-to-skin contact, especially during sex. The scary part: most people don't even know they have it because they never feel sick. But left unchecked, some types can lead to serious problems like cancer. So if you're sexually active or planning to be, this matters to you. So what causes HPV? It's caused by a group of over 200 related viruses, all under the HPV family. Think of them like cousins. Some are harmless and cause warts on hands or feet, while others enjoy hanging around the genitals and mouth. You get infected when the virus enters your body through a tiny cut or tear during skin-to-skin contact. For example, if you have sex, vaginal, anal, or oral, with someone who has HPV, you can get it, even if they have no symptoms. It's kind of like borrowing a towel from someone with a foot wart and getting one too, but in more private areas. And yes, even people who look perfectly healthy can carry and spread it. Now, do you feel any odd bumps down there? Maybe small, flat, or cauliflower-like warts around your genitals or anus? That's a classic sign of some HPV types. But here's the kicker: most people with HPV have zero symptoms. You could be infected for years and not know. However, certain high-risk types like HPV 16 and 18 don't cause warts, but can quietly change cells in the cervix, throat, or other areas, and eventually lead to cancer. For women, this might show up later as unusual bleeding after sex or between periods. For anyone, a sore throat that won't go away could be a sign of throat HPV. The virus is sneaky because it often hides until damage is done. How do doctors find out if you have HPV? For women, a pap smear, also known as a pap test, checks for abnormal cells on the cervix, kind of like a yearly car inspection for your reproductive health. If those cells look weird, a follow-up HPV test can confirm if a dangerous type is present. Men don't have a routine test yet, which is why noticing genital warts early matters. If you see them, snap a photo, yes, really, and show your doctor. No cure exists for the virus itself, but treatments focus on the problems it causes, like freezing, cutting, or using creams to remove warts. Abnormal cells can be removed before they turn into cancer. So catching it early, priceless. What if you could stop HPV before it even starts? Good news, you can. The HPV vaccine, like Gardasil 9, is super effective and recommended for boys and girls around ages 11 to 12. Yes, even before they become sexually active. Think of it like a training session for your immune system. It learns to fight HPV before the real enemy shows up. Using condoms helps reduce spread, but since HPV lives on skin not covered by condoms, it's not 100%. Still, it's better than nothing. And regular checkups essential. Imagine your body as a house. Routine cleaning, screenings, keeps pests like HPV from causing big damage. Scientists aren't sitting still. Recently, researchers are testing therapeutic vaccines not to prevent HPV, but to treat people already infected or with HPV-linked cancer. Imagine a cure that tells your immune system, hey, destroy these bad cells now. Some trials show promise in shrinking tumors. Also, self-testing kits for HPV, like at-home swabs for women, are being studied to make screening easier, especially in rural areas. And guess what countries using the vaccine widely, like Australia, are so close to eliminating cervical cancer that it's no longer considered a public health problem there. That's hope in action.